تكون شريك مع راديو. سنقوم ببث برنامجك عبر مواقع متعددة مثل واو، أويل، كواجوك، يامبيو، بور، رنج، ملكال وباليد، وبيضمن أقصى قدرة من التغطية والتأثير.
التواجد الإقليمي: بتمتد بصمة آي راديو إلى ولاية غرب وشمال بحر الغزال، غرب والاستوائية الوسطى، جونغلي، أعالي النيل وواراب. من خلال التعاون مع آي راديو يمكنك التواصل مع المجتمعات المتنوعة والجماهير المستهدفة في المناطق ديل.
مشاركة المجتمع: الشراكة مع راديو بتعني التعامل مع مجتمعات على مستوى الشعبي. رسالتك حتوصل للمستمعين في مواقع مختلف، مما يعزز التفاعلات الهاتفة ويزيد الوعي بعلامة تجارية.
التغطية الشاملة: مع محطات في مواقع استراتيجية زي الرنج، ملكال وباليد، بتوفر آي راديو تغطية شاملة بتصل إلى كل من المراكز الحضرية والمناطق الريفية. بتضمن شراكتك مع آي راديو الرؤية عبر منطقة جغرافية واسعة.
ما تفوت فرصة توسيع نطاق رسالتك باستخدام آي راديو. شارك أو أعلن معنا الليلة وخلي صوتك مسموع في جميع أنحاء جنوب السودان.
هل انت شاب وبتفتش عن برنامج تعليمي؟ زون 72 برنامج خاص لك انت، بيتم فيه مناقشة كتير من المواضيع اللي بخصك، وفيه انت ممكن كمان تعبر عن رأيك وتتواصل مع شباب بنفس تفكيرك. زون 72 بيجيكم في كل يوم السبت من الساعة 4 مساء للساعة 5 مساء على الهواء وعلى الإنترنت، فقط على أي راديو. عينك على جنوب السودان.
Yes, good evening, listener of iRadio, and welcome to the Zone 72 Youth Program, which comes to you every Saturday from 4 to 5 p.m. I'm your host, Barry Johnson, and as usual, I also have with me in the studio Grace Amviko, who is our sign language interpreter. Zone 72 highlights the rights and choices for all adolescent and youth, and it emphasizes on the three-pillared global strategy for adolescent and youth, putting young people at the center of sustainable development. Zone 72 Youth Program is in collaboration with the South Sudan Ministry of Health, South Sudan Nurses and Midwives Association, Shabab Le Shabab, Canadian Association of Midwives, and UNFPA. The program is made possible with support from Global Affairs Canada. Well, to comment on today's program, you'll be calling us on our studio lines, that is 0911 or 0922986986. And for text messages, send to 0913986986. You can also stream this broadcast live by logging onto our website, that is www.iradio.org, on our Facebook page, iRadio. You can also follow this program on our live stream on our YouTube channel, that is iRadio South Sudan. Well, if you have questions about adolescent health, send us an email to youthzone72@gmail.com or call 0922 009497. We also have two hotlines, and they're toll free. If you want to report on GBV, you can call 623, and if you want to report on adolescent health immediate, call 885. Today we're going to be looking at a very important topic, which is family planning, and we'll be looking at what family planning is, why it is so important, and some of the misconception surrounding family planning. And to shed more light on our topic today, I am happy to have with me in the studio Dr. John Mario, who is a consultant obstetrician and gynecologist, and I also have with me William Sabah Daniel, who is a registered nurse. Good evening.
Good evening.
Good evening.
Yeah, you're both welcome to the Zone 72.
Thank you.
نعم مستمع اي راديو، اللي احنا ماشيين نتكلم عن تنظيم بتاع الاسره، فخليك قريب مع الراديو بتاعك عشان يكون عندك فرصه تسال دكتور حقتنا في داخل الاستديو، وبرضو ويليام لو انت عندك اي سؤال، ولو دارت تشارك تجربه حقك برضو عن موضوع بتاع التنظيم بتاع الاسره، هيكون عندك فرصه بعدين عشان تتصل تليفون وتسال ضيوفنا في داخل الاستديو السؤال بتاعك. Yes, starting our program, let me start with Dr. John. If you can tell us in a simple language what family planning is, and why is it so important for families and communities here in South Sudan?
Thank you, Barry Johnson, for hosting us today. I'm Dr. John Marioma, obstetrician and gynecologist. Family planning is a form of a synthetic hormones, and it is made to either to delay ovulation, or either to to make the pregnancy not to happen. And the reason for the family planning is that one of the aims is to do a spacing. And the importance of having a spacing is that, a frequent baby bearings have a lot of complications to a woman's health. And also economic-wise, it also adds more burdens on the family. So those synthetic agents act to alterate the normal physiology of the menstrual cycle and ovulation, and that leads to the pregnancy not to happen. Yes.
Okay, and apart from the economic aspect that you talked about, why is it so important for families and also communities to consider family planning?
Yes, family planning is very important. For example, let me start with the age who are at the risk. For example, the teenage and the adolescents. The rate of unintended pregnancies is very high on those age group, and family planning is one of the ways to break that chain. For them, because at that age they're not ready yet to bear babies, to take care of them, and also they're still having a lot to go with. Like, for example, they have to go for school to finish their education. So family planning is one of the things that's very important to the communities. The second thing is that by having family planning, we'll be able to minimize the risk of those unintended pregnancies. Like, for instance, those who have unintended pregnancies, they may go and try some other ways of maybe getting rid of that pregnancy, and they will end up with a very devastating kind of complications, which later on will lead to them losing their lives. By having family planning, that helps them not to reach that level of having those unintended pregnancies. By doing this, we also have a healthier community. The rate of complications of those anti-pregnancy will also be less, and it also health-wise that will lead to healthy communities in the future.
Okay, yeah. Let me come to William. Can you maybe walk us through the most common type of the contraceptive method used here in the country, and how do they differ in terms of effectiveness and accessibility?
Okay, thank you very much. iRadio for hosting us. My name is William Saba, as you have said. I'm a member of Sanama, and I'm a registered nurse. Just briefly to define what family planning is, I just want to shed some light on it. Family planning actually is a critical component of public health, women empowerment, and sustainable development, whereby individuals decide on the number and spacing of children. That is through the use of contraceptives and other methods. Now, when we look at the types of family planning are of different types. We have short-acting methods, long-acting methods, and so on. So when we look at the short-acting methods, we have things to do with male condoms, whereby when you want to have sex and maybe you don't want maybe your partner to get pregnant, you can actually use the male condom. We also have female condoms, in which most of our women in South Sudan, I don't see most of them utilizing it, because whenever we go out for family planning advocacy, like Sanama used to send us to the community, we do family planning advocacy, whereby we offer some of these family planning services, whereby we give out free male condoms and female condoms. We have actually come to realize that female condoms are not actually prioritized by women, and this may be because of the shame. Because when a fellow woman sees you with a female condom, they tend to discourage. So we also have long-acting methods, like the IUD, that is the intrauterine device, which is normally inserted in the uterus, whereby it blocks once you are having sexual intercourse. If a man releases this IUD, normally blocks that sperm from traveling to the ovary, whereby a woman might end up getting pregnant at the end. And then we have other methods like the one they insert, that is the okay. We also have permanent methods, that is the tubal ligation, whereby the tube can be cut so that sperm cannot actually travel through to the uterus, and whereby a woman can get pregnant. We also have the male sterilization, whereby the vas deferens is actually also cut to prevent sperm from actually coming to fertilize the egg once a man is having sex with a woman. Then we also have traditional methods whereby people talk of the withdrawal method, which is, I see at times, very risky. If you're actually having sex, when you reach that climax whereby you are at the point of releasing, sometimes some people may release in, but it is one of the family planning methods. We also have abstinence, which I see is also good for our population. So these are some of the methods.
Okay. All right. Thank you, William. So coming back to you, Dr. John, what are some of the medical factors a woman or a couple should consider when choosing family planning?
Thank you. It's a very important question. There are a vast number of medical conditions that a woman will have to be advised on going for a family planning, so that to give chance for those conditions either to be treated first so that they will be ready for bearing babies, or other conditions also may prevent them from getting pregnant, because the pregnancy itself might add burden on those certain conditions. For example, heart diseases. There is certain kind of heart diseases like pulmonary hypertension. Those category of patients, if they happen to have this heart problem, they are advised not to bear babies, to get pregnant, because during pregnancy, those physiological changes of pregnancy will add more burden on their heart, and also it will worsen their condition. So they will be advised to go for family planning so that they don't get pregnant. Other conditions like, for example, molar pregnancies, like when they are already they are treated, immediately after the treatment, there will be a period of follow-up, a serial follow-up for the condition. So we will also advise them to go for family planning, so that this will give a chance for those follow-up to be done properly. After that, after the period of follow-up gets finished, then they will be ready for getting pregnant. Others, like those with hypertensive disorders during pregnancy, like preeclampsias. Okay, if they already have the incident of preeclampsia during this pregnancy, for them, for the next pregnancy, before they conceive again, because they'll be having a risk again to have the same in the next pregnancy, so that we will also counsel them about the family planning, so that they have enough time for spacing, and also getting ready for next pregnancy. Women who also had complications during the current pregnancy, for example, those who develop postpartum hemorrhage, anemias as a complication of postpartum hemorrhage. So we also advise them on a proper spacing, so that their body has to rebuild again before they be another pregnancy in the future. They'll have to go for a family planning. There are other many conditions that a doctor will advise those mothers before they get pregnant again. They'll have to go for family planning, so that those issues has to be addressed first. Then after that, they will be ready for bearing another baby. I've just given a few examples for it.
Okay, and also, Dr. John, many people worry about the side effects of family planning. For example, like the irregularities in the menstruation. So can you help us understand which side effects are common and which are rare, and how can they be managed safely?
Yeah, the family planning are classified into categories. There are hormonal ones and there are non-hormonal ones. Mainly the hormonal type of family plannings, those are the ones having those side effects. For example, the estrogen containing family planning types, either the implants or the Depo-Provera, the injectable ones, or the other name is Sienna Press. Okay, those side effects they are there. When we come to provide family planning, the first thing we do, we go through those several types of family planning. We tell the client about those types of family planning and what are the side effects that are expected from those family plannings. Irregularity of menstrual period is one of the side effects of those hormonal-based family plannings. They will have to know that whenever they take those family planning, they are expected to have irregularities in their menses. Sometimes they may become totally amenorrheic, which means they will not see their period at all during some of those type of family planning, or they can have irregularities when they're taking those family plannings. Then after they know all these side effects, so that they are now the one to choose if they are comfortable to go with one of it. After they choose, also as a doctor, there is something called medical eligibility criteria. You also have to evaluate that one. For example, it means what this medical eligibility criteria. Like for example, if a woman chooses to go for injectable type of contraception, then me as a doctor, I will see her. Is she eligible to this type of family planning? Does she has a condition that will be worsened when she takes this family planning? For example, is she hypertensive? Does she has conditions concerning the vascular system, like her veins and arteries, those thromboembolic incidents? Does she have those previously? If anything that she has, we found that this type of family planning will make it worse, then we are the one to advise now. This type of family planning is not suitable for you, because if you take it, it's going to cause more problems because of the condition that you're having. Yes, sure, the irregularities are there as a side effect of family planning, provided that you're taking that type of family planning. If it is there, this is one of the side effects, so they have to know about it.
Okay.
Thank you.
All right. Thank you, Dr. John. William, coming back to you, you said earlier that you go out and do awareness on family planning. So what are some of the misconceptions that you get from the public about family planning? People have fears and misconceptions surrounding family planning. So what are the most common ones that you get when you go out to the public for awareness?
Thank you so much. As I said, we as Sanama, we have been going out to the community doing advocacy on family planning, and we do actually face a lot of people talking about the misconceptions or myths about family planning methods or the services. And one of the misconceptions which most of the people used to talk about is that family planning is just something considered for the Westerners. It is not for us, the blacks. And through health education, through counseling that we normally give them, some of them come to understand that it is not only for Westerners, but it is for everybody. And then in most of our communities, people look at women who actually get access to family planning as prostitutes. That these are prostitutes, these are not good people. And they mention a lot of things about them. And then some women go as far as looking at family planning as something that can bring out the uterus. I remember one of the women saying it when we were actually doing a medical campaign in Gumbo Sirikat. Galaja de bitala rihim tanas bara. And then I was like, do you have the evidence? Galua kamanas mamalizeran, meaning that it is just a misconception.
Yeah.
So with all this, when normally we are giving out these services, what we first do is to cancel them. We clear out these misconceptions first. We make them understand that this family planning is not actually for prostitutes, but it is very important in a way that doctor has highlighted before. One, family planning in the first place helps in prevention of intended pregnancy. Family planning also helps in the sustainability of it actually reduces financial burden on families. Meaning that if you have very small size of family, a family whereby where they use family planning, it's financially you can provide for all the basic needs. Then in a family whereby family planning is not considered, you find providing the basic needs to the children becomes very difficult. You find children are very many, you cannot pay their school fees, you cannot buy clothes for them, and they end up on the streets. So all these things, we provide counseling first, and we clear out their doubts or the misconceptions, and then now we provide the services.
Okay, all right. And also, William, from your experience, do you see like a husband and a wife or couples coming for family planning counseling, for example, or it's mostly women coming alone?
Okay, through experience, and this may come to male involvement in family planning, it has been very poor. It is very rare for you to see couples coming to the facility to access family planning services. And this also raised one of the research topic that I and a colleague conducted in Gumbo Sirikat. Just because men do oppose family planning, they don't support their partners when they are accessing family planning services. One of the women one day told us that she actually wanted these family planning services or the methods so that she uses, but the husband is not supporting her. And whenever she wanted to come to the facility, the husband used to say that kanana inita yom wide ita agi no ajalo bi kutuini de wala ana bi katu later. So because of the perceptions of men, which are actually very negative towards women accessing family planning methods, we conducted the research, and we also came out with some findings and recommendations. So because of this, men really need to support their partners. More especially, it is very important that you come with your wife to the facility, and you have the services together. You discuss with the doctor, and your wife gets the services. Even the man can also be given some of the family planning services that are for men, like the male condoms. It is not actually something that is only for women, but it's for all. Only that the perception of men affects women negatively.
Okay, all right. Yes, Dr. John, is it also the same case with you? Do you only see women coming for counseling or to access family planning services? And how important is it also for men to be involved in this whole process?
Yeah, that's true. My colleague has touched some of the challenges actually. What we experience most of the time, women are the one coming alone seeking for those services. They come, they ask about the family planning, they would like to know more information, especially those who did not use it before. They would like to know more information about family planning, and also they are looking at us to assist them to choose which the best option for them, so that they can use it. This is a category of our clients. Others, they have that when we advise them, because as already we discussed earlier, there are some a certain medical conditions whereby we are the one to advise mothers to go for family planning. And when we start advising them, now the challenge comes that they will start mentioning something about their partners. They will say, like, now if I start taking those family plannings, it's going to bring problem to me with my partner or with my husband. Like, the husband will not be happy that she's taking family planning, and they will think that she's now having different intentions, for example, for taking this family planning. And it is our role that to bring them together, to call both the husband if they are ready to come, so that they come and they listen to us. Why are we advising them to go for family planning? What I've realized from our practice till date, our communities we are coming up, and like we are our sense of health awareness is now improving. If you compare like 2 years back, even now I can see male partners who are accompanying their wives to ANC follow-up, to antenatal care, which is very good. This one, if you compare like 5 or 10 years back, it wasn't there at all. It wasn't happening at all. But this is also a good sign that our health awareness is improving. Those challenges are there, but still we are the one to call both partners to come, so that we explain to them, so that they understand why we are advising on family planning. Yes, there's a lot of misperception about family planning. The husband may think that a wife, by taking family planning, she's intentionally doesn't want to get pregnant, or she's planning maybe to go and play somewhere.
Yes, so that she will not be caught.
Exactly. So which is very wrong most of the times. When doctors are advising on those family planning, it's good for us to come together to listen, so that we understand why are they advising on the family planning. Okay.
All right. Yes, listen of iRadio, this is your chance to call us on 09110922986986 if you have questions or concerns about family planning, so that Dr. John and also William will answer your questions there. اتصل لنا في 0911 أو 0922 إذا أنت عندك سؤال عن تنظيم بتاعة الأسرة، أو أنت عاوز تشارك تجربة بتاعك برضو في كلام بتاع تنظيم الأسرة. إحنا عندنا دكتور جون معنا في استوديو، وبرضو معنا ويليام وهو ريجستد ناس ممكن يجاوبوا لكل أسئلة بتاعكم. And to you who is following us on our Facebook live stream, you can also drop your comments and questions there, and our guest will answer them. iRadio.
Yeah, good afternoon.
Yes, good evening. Tell us your name and where you're calling in from.
Yeah, Benjamin.
Yes.
From Sherikat.
Benjamin from Sherikat. You're welcome.
Okay. So, it's very nice family planning. I want to ask only one question to the doctor. Because now, you see, when you see this lady is going to the clinic or to go some hospital, they need family planning. The concept is for them not to produce too much because they may be affected by finances. But sometimes you may find a woman put the family planning. Then, if she may put the family planning, then the period will not come. Until you want to go back to the hospital again to go and get some those family planning stuff, then after you have taken them, then the period will come. So what if they pay the client or the woman, they not take that medicine again, and they have taken it, and the period does not come? What is now the solution for it?
Okay.
So because I have seen it several times, you may put it this before you inject it, or the other capsule you are giving, or the implant, the one you put. Sometimes the period may not come up. The course before is for 3 months. And even the implant is for 3 years. And especially the default is the one having more side effects. what is the best medicine now that people may take without fear that it will not do anything side effect on them?
Okay, all right. Okay, thank you, Benjamin, for your question. Yes, 0911 or 0922986986. Call us on these two numbers and you'll be connected with us live in the studio. iRadio. Hello, iRadio. iRadio. Okay, sorry, we are not getting your voice clear, but you can still call us back on the same number 0911 or 0922986986, and you can share with us your question, or if you have a testimony about family planning. iRadio. Hello, iRadio. iRadio, good evening. Okay, sorry, it could be a network issue, but you can still try again and call us back on our same numbers. You can also drop your questions and comments on our Facebook live stream. iRadio. Okay, this could be a network issue. Maybe Dr. John, if you can answer Benjamin's question. Benjamin from Gumbo.
Yes, my answer to Benjamin, as we stated already, before choosing a method of family planning, we do counsel the clients and we do take them through each and every type of family planning concerning the side effects of those types of family planning. Like, for example, he mentioned about DPO. Yes, DPO is having the side effect of menstrual irregularities or sometimes absence of menstrual period, as well as other implants. Okay, like if it is Nexplanon or Jadel. When a woman accepts, for example, to take Depo or Implanon, she's already aware that she might have those irregularities, or she might totally not see her period during the time that she's taking the family planning. So and that one will not be a surprise for her if we already tell her about the side effects. During the time of this family planning, when she's taking the family planning, if they come and complain about those menstrual irregularities, for those who did not know about the side effect, again we reassure them. We will tell them that now you are not seeing your period because of this type of family planning that you are taking, or this period is not regular because of this type of family planning that you are taking. If they felt uncomfortable with them, then they have the chance to change them with another method. For example, the COC, the combined oral contraceptives. This one doesn't have problems with menstrual irregularities or absence of period. They will keep seeing their periods every month regularly when they're taking the combined oral contraceptions. So they may go for that option if the menstrual irregularities or absence of period is a great concern for her.
Okay.
Sometimes, for example, after discontinuing Depo, for example, others may still remain without seeing their period. When they come, for example, they complain of that, and it is a time that we are going to give them again the combined one so that they will start seeing the period and the period will continue regularly. Yeah, thank you.
Okay. All right, let's pick another call. iRadio. Hello, iRadio. Okay, you can still call us back on the same numbers. Let's go through some of the comments and questions on our Facebook live stream. We have Goj Dude. He says, introducing comprehensive family planning education in high school can be beneficial for students, offering them vital information about reproductive health, contraception, and responsible decision making. However, there are valid concerns that needs to be addressed. And one, he says, empower teens to make informed choices. Education can help adults understand their bodies, the risk associated with sexual activity, and the various contraceptive options available. Second, he says, reduce unintended pregnancies and STIs. Comprehensive education can equip students with knowledge to make responsible choices, potentially leading to a decrease in unintended pregnancies and the spread of sexually transmitted infections. And thirdly, he said support healthy relationships, understanding the dynamics of relationships, including communication about contraception and sexual health, can contribute to healthier and more fulfilling relationships. And lastly, he says provide access to resources. School-based health centers or collaborations with local clinics can provide access to resources like contraception, STD testing, and confidential counseling. Okay, thank you so much, Goch Dud, for your inside. We have Ayap Nyaj. He says, I think society needs to be given adequate information and knowledge on family planning so that we invest to prescribe different methods of family planning. It's important to create demand and sensitization to rupture the myth and unacceptable trends of family planning. And then we also have Benny Amalgam. He says, what specific family planning services does he means Sanama offer, and who is eligible to access them? So William already earlier on mentioned the types of family planning offered. Maybe he can later on answer on who is eligible to access them. And he says, secondly, what message do you have for families who believe that family planning is against their faith or traditions? And yes, and he has another question. How does Sanam address gender-based barriers where women need their husband's permission to access family planning? And yes, that's all from our Facebook. So William, maybe you can answer these questions. He has 3 questions for you. You already mentioned the types of family plannings available. Maybe you can answer on who is eligible to access them, and what message do you have for families who believe that family planning is against their faith or traditions? Yes, you're welcome.
Okay, thank you so much. What was the name of that?
The name is Bani.
Bani?
Yes.
Thank you for the good questions. Like you have said, I've mentioned most of the family planning methods where I talked about the short acting, where we talk of male condom, female condoms, and so on, and the pills. We also look at the long acting methods like the IUD, the implants, and so on. Now coming to eligibility. In family planning, we look at women of reproductive age, more especially even a girl from 12 years who has seen her menses, meaning this lady is mature enough and needs to be given family planning services so as to protect her from an early pregnancy or unintended pregnancy, meaning that from women of reproductive age, like from 15 to 49 or even above, deserve to have access to family planning methods. We also have women who suffer from other medical conditions like HIV can also access family planning methods. So it is not restricted in another way around.
Okay, and there is another question he is asking. What is your message to families who believe that family planning is against their traditions or their beliefs?
Okay, like for us, when we go out for advocacy, or what Sanama normally do is that we do engage these stakeholders, whereby we bring in religious groups, community leaders in the training. We train them about the importance of family planning. We disseminate these messages because they are the ones who are in the community. Once the community leaders understand the importance of family planning, and also these religious leaders understand the importance of family planning, they are the one to advocate, or they are not the one to disseminate the messages to the community that all we have about family planning can help us actually sustain our community. Like for example, if we have a manageable number of family, all the basic needs can be provided. Like in Juba now, some people yawn gali can plan because they plan their family. You see, they provide all the basic needs for their children. Maybe before their children go to school, they take tea, they take lunch, and maybe supper. Meaning that they utilize family planning, they don't produce beyond their budget, and they are able to contribute to the development of the society. So it is very important that community members take the importance of family planning, and that is what we are actually looking toward to as Sanama, as part of reproductive health.
Okay, all right. Thank you, William. Also, the same question to Dr. John on the issue of traditions and beliefs. So, what role do families, religions, and also community leaders play in encouraging or discouraging family planning?
The community leaders. Let me start with the community leaders. The community leaders has a great role to play when it comes on community sensitization concerning the issues of family planning. Because there's a lot of misperceptions going within the community when it comes to understand what is family planning and what family planning does. When we give the right information about the family planning, we also have to engage, we have to reach to the grassroots, we have to engage the community leaders so that they get the correct information about the family planning and what family planning does. And in turn, they are the one also to deliver the message to the community members. So their role concerning the family planning misconceptions, they play a great role on that one. And they have to be really fully engaged when it comes to those issues of health awareness and health sensitization. Okay. When it comes to religious belief, yes, there's a diverse religious belief concerning the family planning. But for us, when we talk on the health aspect, we do consult them about the risk and the benefits of taking the family planning. Health-wise, without going deep into the religion aspects. And this issue of religion aspect, I think we have to leave it to the religion people.
Yes.
So that
Yes, okay.
I don't want to go much on that.
All right, thank you. Let's pick some calls. iRadio. Hello, iRadio. Okay, we are not getting your voice. You can call us back 09110922986986. Our broadcast time is 42 minutes past the hour of 4. You still have a chance to call in and direct your question to our guest in the studio. Remember, we are talking about family planning أو تنظيم بتاع الأسرة. كانت عندك سؤال للضيوف حقتنا في داخل الاستديو، أنت ممكن تتصل تليفون حسي وتسأل سؤال بتاعك. Going back to our comments on Facebook, we have a comment from Akech Deng, and he says, watching live from China, I appreciate the guest for highlighting public key messages on family planning. My question goes to Dr. John from Argos, and he's asking, what are the intervention Argos, what is Argos intervention regarding the perception on family planning to reduce the burden of high maternal mortality rates in South Sudan? Yes, you're welcome.
Thank you. Argos is the Association of Gynecologists and Obstetricians of South Sudan.
Yes.
And I am a member of that. Argos is one of the mandates of the association is the sexual and reproductive health. It has a lot of sexual and reproductive health activities. Argos is closely engaging with the partners who are working on the family planning ground, and they are conducting trainings concerning the family planning countrywide. Those trainings aim to increase community sensitizations about the family planning, and also to update, to improve the family planning uptakes. Because if you see our communities, we have diverse communities in South Sudan, and when you compare from one community to another, you will find that the perception concerning family planning and the understanding concerning family is different. So through those trainings and engagements, those things are going to improve. And these are one of the activities that AGOS is doing. They're doing really those trainings so that to improve the perception and the family planning uptake. Yes.
Okay. I'm going to come back to William. I want you to, if you can share with us briefly, maybe a real life story of someone who benefited from family planning. Without mentioning names or location, just maybe a brief real life story or a testimony of someone that you have worked with and benefited so much from family planning service.
Okay, thank you. This story was actually from one of us, a member of Sonoma. Like Dr. John said before, family planning, these different family planning methods has got different side effects. And one of the colleagues has also been suffering in silence. She was actually taking one of the family planning methods. And this lady has been having some irregularities in menstruation period. So what the lady did was to come to one of the colleagues also and explain that she has been having problem when taking this family plan, the injectable one, the depot, which has got so many side effects. And then this lady was like, she has injected it and she has not seen the menses for some good number of months. So what that colleague was actually advised her is to change to another method of family planning method, of which she resorted to the COC, that is the combined oral contraceptive. So for this one, it doesn't prevent or stop your menstruation period. So from that time, after shifting from the depot, she started seeing her menses normally. So that is a story that one of our members shared with us, and she was very happy because she's a health personnel and she also fears. Yeah.
Okay. All right. Thank you so much, William. Going back to our some of the comments on our Facebook live stream, we have Esther Henry, and she's asking, my question is, does family planning lead to infertility? Maybe Dr. John will answer that. And then we have Mila Chaplin. He says the prevalence of family planning service in South Sudan still remains low. My question to the guest in the studio, what should be the possible way to address this matter? So this is Chaplain Mila from Munuki here in Juba. Okay, thank you so much for this question. And then we have a quote back. He says, good evening, iRadio. I'm watching live from Kampala, and I'm truly excited to see people discussing the topic of family planning. Could you kindly explain what family planning really means for our society and our country as a whole? Many of us South Sudanese often misunderstand such topics, or just perhaps we just struggle to accept new technologies or ideas. Okay, so Dr. John, maybe you can answer Esther Henry's question, if family planning leads to infertility, and also Mila Chaplin, who is asking about the prevalence of family planning service in South Sudan, and what can be done to address this matter.
Thank you for those two questions. Concerning the first question of Esther, family planning does not cause infertility, and this one actually one of the misconception about perception about family planning. Majority of women or community members, they say family planning, when you take family planning, you will not be able to produce again, even if you stop it. So it is one of the misconception. Family planning doesn't cause infertility. It works by just, you will not get pregnant during the time that you are using the method. But after you stop using the method, then now you will start ovulating again, and also you start seeing a period. Now you will conceive again. It doesn't cause infertility. Other types may delay conception, like for example Depo, the injectable ones. After stopping it, you may delay from resuming or from getting pregnant, not like the implant and the other types. This is one of the side effects of the injectable one. Yes, it can delay the conceiving, but it doesn't cause infertility. Yes, we are concerning that one.
Okay, there is also another question that how is hormone injectables related to the development of fibroids in females? There is this question also.
This one also is a misconception about the injectable hormones. It doesn't cause the development of uterine fibroids. Uterine fibroids development has different causes and different physiology. So family planning or injectable hormones is one of the is not one of the cause of the fibroids. So it's not correct.
Okay. All right. Okay. Thank you so much, Dr. John. Yes, we're going to give a chance to maybe one or two last callers before we conclude. iRadio. Hello, iRadio. iRadio, good evening. Okay, sorry we are not getting your voice clear, but feel free to call us back before we conclude with the program. 09110922986986, and you can ask our guest in the studio your question. Yes, William, now if someone wants to start using family planning today, for example, where should they go and what should they do?
Thank you. If a woman wants to access family planning methods, my advice to them is that we have so many facilities in the country. We also have clinics. We have PSCCs, we have the main hospitals and so on. You can easily go to any of the facility which is nearby your place, and you can be provided the services. Normally in family planning clinics, we have very friendly healthcare providers. Once you go to the family planning unit, first of all, they welcome you. Then they tell you about the availability of the family planning services that are available in the clinic or in the facility.
Yes.
Then they also provide an informed choice or decision making. After telling you everything that is available, it is you to decide. Like Dr. John has stated before, once you are giving them the counseling, you tell them about the side effects of each and every family planning method so that they understand and they make their informed decision based on the side effects and so on. So family planning services are actually available in most of the family planning clinics in Juba, in private hospitals and so on. So it can be accessed anywhere. Though we have challenges in some of the facilities whereby some of the clients may go there and they are not there. But the partners are actually trying so hard to support the government in the provision of the family planning services in the government facilities and also in the private hospitals.
Okay, all right, and also to Dr. John, what message do you have to a listener who is still unsure or is hesitant about family planning? And if you can maybe speak in English and then conclude that in simple Arabic also.
Okay, thank you. Family planning, as already stated, is one of the tools that prevents a lot of reproductive problems or complications in the future. Accessibility to family planning is available countrywide. We have most of the government institutions, the hospitals and the primary healthcare centers, plus other private hospitals. The services are there. A well-trained healthcare providers are there. They are well-trained on how to counsel you about the family planning, to give you the right full information about the family planning, and also to assist you on how to choose the method of family planning. We should not fear family planning. Yes, some of it has side effects, and those side effects can be addressed when it happens. It's not something that beyond the capacity of the healthcare provider to address it. My message also goes to those who is still hesitant because of those misinformation or misperceptions about the family planning.
Yes.
If you need a correct information about family planning, please you come to the healthcare provider in a designed health facility, either governmental or those private who has the services. You come so that you get the rightful information, so that you be sure about what is family planning is. Maybe let me say it in Arabic.
Yes.
تنظيم الأسرة هي من الحاجات المهمة يعني متواجد في معظم المراكز الصحية والمستشفيات الحكومية الموجودة في البلد. في معلومات كثيرة ما صحيحة يعني في مجتمع بتاعنا بخصوص تنظيم الأسرة. عشان انت تلقى المعلومة الصح عن تنظيم الأسرة وبعد من الآثار الجانبية بتاعت تنظيم الأسرة، انت زور أقرب مستشفى أو مركز صحي كان حكومي ولا كان خاص اللي عنده خدمات بتاعت تنظيم الأسرة. في أطباء أو ممرضين أو دايات موجودين مدربين في تنظيم الأسرة. هم هيدوك المعلومة الصح وهيساعدوك برضو إنه كيف تختار النوع بتاع تنظيم الأسرة اللي انت عايز تستخدمه. أنا هنا لازم نزيد من درجة الوعي للمجتمع بخصوص تنظيم الأسرة، لأنه تنظيم الأسرة يعني بيساعدنا كتير كيف إنه نتفادى جزء كبير من المشاكل الإنجاب أو مضاعفات اللي عنده علاقة بالإنجاب. شكرا.
اوكي، شكرا كثير دكتور جون، وبرضه شكرا لويليام صبا for this interesting conversation. Thank you all for your questions and comments on our Facebook live stream, and those who tried to call but it was either network issue that we could not get your message clear. And also I would love to thank our sign language interpreter, that is Grace Amviko. Until next week,